There are also differences in the kinds of articles that medical researchers will write up and publish, not just research papers, review papers, and primary outcome research as other academics are writing and publishing, but also case studies, clinical reports, drug discovery reports, perhaps trials and interventions. These we're going to come back to and talk about a little bit later in this presentation, because trials and interventions in medical research, of course, have clear and distinct ethical issues around them as well. So this is another big difference, as we'll talk about a little bit later in this presentation. This is another big difference between medical research and other kinds of academic research that we encounter at our editing companies and also at Bentham Science, the different kinds of medical articles that there are that people may publish. And don't forget as well, it's well worth considering what's happening at the moment. We are living as researchers, and this is of course particularly the case for medical researchers, obviously in the midst of a pandemic. The COVID-19 paradigm has had a dramatic effect on the publishing industry. And now, as medical researchers, there is an opportunity to get work published faster and more effectively than may have been the case before. The onus, especially in areas of medical research that touch upon public health, that touch upon the socio-economic aspects of the COVID-19 situation, the publishing industry puts the onus back on authors at the moment. Journals want articles and they want to publish them fast. So you have an opportunity not just to get your work written effectively as researchers, but also potentially to get it published faster. This is, of course, a daily, a global topic. So it gives us the opportunity at publishing companies, at companies like Bentham Science, to think about how journals have been supporting the paradigm at the moment, encouraging authors to publish and often supporting the process of medical publication by, for example, creating new journals, providing expedited peer review processes by waiving article processing charges for full open access journals, and giving the green light for articles that are already present perhaps on preprint servers. We also support younger authors. Journals want to publish papers on COVID-19 in particular so that they can make a contribution. And of course, it's all about readership. At the end of the day, journals want readers, journals want to make an impact. So as we start our webinar today and we think about medical writing in particular, it's also quite interesting for us to consider what's happening at the moment in this context. What can you do as an author? How can you speed up your publishing process? How can you speed up your publishing experience? So there are a number of ways that you can be effective as an author before you even start to write. And one important way is to make what are called pre-submission inquiries to journal editors. Send out emails to potential target journal editors before you even write your next article. Emailing editors and asking them, will this work that I've completed be of interest to your journal? This doesn't imply any submission commitment. You can send 10 to 20 emails, even more. Tell editors about your work. Editors will guide you. They'll come back to you and they'll say, this sounds great. This would be a good topic for our journal. Or they might say, no, this is not appropriate for our journal, but we have another journal in our family that may be just as good. And you can then get your work potentially published faster. Pre-submission inquiries are asked for by top high impact factor journals, of course, but not enough authors do this anyway. And so get ahead of the game, be effective, ask editors before you start to write, will you be interested in potentially publishing this piece of work? Reverse the process. Ladies and gentlemen, most authors submit and then wait, often for months, to get those review comments back. It doesn't have to be that way for you, especially as we know that you're busy medical researchers, probably juggling several other clinical responsibilities, teaching responsibilities. You can speed up that process. The other way that you can expedite, you can speed up the publishing process as an author, is to use a preprint server. These are online open access repositories where non-peer-reviewed articles can be placed even before completion. Get fast pre-submission feedback from experts in your community and make fast and accurate changes to your work. You put your finished clinical trial report, your finished intervention, for example, onto a preprint server, such as the two relevant ones I've listed here on this slide, and journal editors will actually come to you and say, this looks like an interesting study. Would you be interested in publishing it in our journal? Make sure that as many colleagues can see and comment on your work immediately. So sending out those pre-submission inquiries, putting your work on preprint servers, and thinking about how you start the writing process. If you select effectively a target journal for your work before you start to write, you will speed up the whole publication process. And we have some tips for you when starting to think about journal selection, aiming high, going for journals with higher impact factors, choosing effectively. And of course, you can get in touch with us. We can help you to make accurate and effective selections for your journals, and selling the submission to the editor. And that's what my job is, helping with training, helping authors to understand the manuscript writing and submission process, to sell and more effectively manage the journal submission process. And don't forget that articles, medical articles, or any other kind of academic article, the structure is key in the writing. This is what we talked about in our last Bentham diffusion editing presentation. If you'd like to see that presentation, listen back to that presentation on the structure of journal article writing, then please do get in touch with the Bentham Science team. They can give you access to replays of that previous webinar recording. We show authors that preparations for writing are absolutely key. The general structure of full research articles consists of two sections, the title and the abstract, and the rest of the paper. Two distinct sections to your writing. Why is it so important to put time and energy into the title and the abstract? Because often that's all that people read. And in particular, in terms of getting your message across to your audience, having a good and effective title is absolutely key. Using the fewest possible words, adequately describing the contents of your paper, and keeping it short and simple in effective English writing to get your message across to editors, peer reviewers, and of course your readers. Concise and informative, get the most important words related to the topic into the title, and entice people. Give your readers the feeling that I want to read, I really want to read this paper. It's an interesting question. Get people enticed, allured, attracted to your article. So I can't emphasize enough just how important an effective short title is. The main issue, the subject, accurate, unambiguous, specific, and complete. No infrequently used abbreviations, and get the keywords of the paper accurate as well, using different keywords than the words in your title, because keywords and titles are what are used by journals, search engines, online search engines. So you want your work to be search engine optimized.